If you've been quoted $4, $5, or even $6,000 for some dental implants in the US, please don't book anything yet. Because in the next 10 minutes, I'm gonna show you exactly what those same dental implants are gonna cost you down here in Tijuana. My name is Diego, I'm the clinic marketing manager, and today we're here with
Dr. Miranda.
So doctor, tell us a little bit about your dental clinic.
Okay, we're a family business for over 40 years here in TJ. My mom started this business. I'm very proud of her. She's already retired and I'm the head doctor right now. We're 5 minutes from the border, really near from the border. Most of our patients are from USA and a lot of them from Alberta, Canada also.
And quick question, why are most of your patients from the US and Alberta, Canada?
The thing, Diego, is that all of our business, it's the same as USA. Our implants, our material, everything is exactly as USA. Then people come because it's much cheaper to do it here in TJ with the same quality than USA and Canada.
Okay, yeah. So it's more expensive in the US.
Oh, they're like 4 times more expensive. We're gonna talk about what's an implant, Diego, okay? An implant is the first, obviously, the implant that goes inside the bone. Then the second part is the abutment, and then the third part, that's the crown, okay? Those normally from beginning to end, we're talking about the first part you can pay that would be more or less like $900 if it's like a normal implant. And the second part, that's the prosthetic part, that's put in the abutment, and the crown would be more or less between $900. Then overall, we're talking about like $1,800 from start to end.
So that's for the whole dental implants?
Yes, from start to end.
Okay, because I see a lot of people advertising for dental implants in Tijuana, but are they most of the time they're just talking about the implants, not about the crowns and the abutment, right?
Yeah, they say like $900 implant, but we're talking about just the implant, not the prosthetic part.
So that's not enough for me to walk out into the street with like a tooth, right? No?
No, it's just the surgical part. Then that's why it's a little bit like, it's like an advertise to bring in patients, but they know they have to pay.
Yeah, but they expect trying to pay $900 and at the end it's like triple the price pretty much, right?
And well, double the price.
Double the price?
Yeah.
Okay. So I know what we're all thinking, right? Why is it so much cheaper? Is the quality worse? Do you use cheaper materials? Where are you guys cutting the corners? Because $1,800 compared to $5,000, that's a pretty big difference.
Well, basically, Diego, one of the things to be here in Mexico, in Tijuana, is that the cost of rent, of about the dental assistant and everything is obviously more cheaper than USA, sorry. Then obviously that's why our prices are much lower than USA. But it's the same quality of the implant, it's the same brand that they use in USA, it's the same techniques, everything, the same machines that we have is the same one that they use in the USA.
Does that mean that every single patient that comes down here is only going to have to pay $1,800?
That's a good question, Diego. If you have missing a tooth for a long time, normally the bone shrinks, okay? Then we're gonna need a sinus lift maybe and bone graft. If that's the case, normally it would be between $300 to, if it's very big sinus lift with a lot of bone, that sometimes that could be the point, would be at most $1,000. That would be the case.
Okay. So what does the typical process look like for a new patient that's coming all the way up from San Diego?
Okay, basically one of our drivers picks you up in the border, and from there he brings us to the clinic, and here we start with the procedure. Okay, the dental treatment. We're gonna do the CT scan, and from there it takes a couple of minutes to see how is everything, and basically we can do it the same day. Okay, a couple like 1 hour to do the surgical guide, because we work with surgical guides. It's easier and quicker the healing process.
Okay, so pretty much I can come the first day, get my panoramic or whatever you need for the 3D
CT scan.
My CT scan, and once I get my CT scan, that same day I could get the implant in?
Yeah.
So I can get my quote and then I could get the implants in the same day?
Yeah, basically we can do everything the same day.
And then can I also get my crown the same day?
Remember, the implant is the first part, and we need a healing process that would be more or less between 3 to 6 months. Then passing those months, we can put the abutment and the crown. Then we're basically talking about at least 2 visits.
Okay.
If you have any questions, put them in the comments and I personally will answer all of them, even the uncomfortable ones.
My name's Diego.
I'm Dr. Miranda.
And we'll see you in the next time.